So some joint supplements are expensive, or they don't work, or they may even cause more harm than good. But if you get a smart formulation, it can actually push you, it can encourage your body towards your recovery, push you forward. So if your recovery feels stuck, right, the right combination of these 5 key supplements we're going to talk about today may help you get there, may help you get better, may help you get to the next level and succeed faster and get to where you want to go faster. So hey there, I'm Dr. Daniel Orcutt, orthopedic surgeon. I've helped and performed over 1,000 surgeries and recoveries from shoulder injury and shoulder surgery. If you're dealing with some shoulder pain, or you're getting ready for surgery, or you're recovering from something, this channel is for you. I'll break it down nice and slow and easy so you can understand what's going on. No fluff, no scare tactics, just real sound advice, expert advice actually, to help you heal and help you succeed through this recovery. So let's get into it. Okay, so before we dive in, just a quick note. All of the claims that I'll be making and describing today are backed by some peer-reviewed studies and clinical data. So if you're interested, you'll find the links in the description of the video today, and you'll be able to do further research if you like on those references. Okay. Also, this video is informational only, right? It's not medical advice. Always, always, always consult your doctor first before starting any kind of new regime or new supplement. And also, if you've had pain for weeks and aren't really sure what's going on, you don't know if it's normal or it is okay or not okay, I did make a quick checklist. It takes about 30 seconds to get through, and it's free. So if you click on the link below for the free checklist for shoulder pain, we'll send that out to you. Again, it'll help you decide whether you think maybe you need to check with your doctor. So click on that link below. Okay, number 1 is actually number 1 in a couple others together: glucosamine, chondroitin, MSM. These are 3 compounds that work together synergistically. So we need all 3 of them together. You just can't have one, but it's almost always together. Glucosamine and chondroitin, that helps build your and protect your articular cartilage. That cartilage is that smooth surface that's on the joints, in the joints, on the bones, at the end of the bones, and that helps again your joints to move. MSM is a sulfur kind of supplement, which is used to make strong and flexible tissue, and also may decrease some inflammation. So it's important to get all those 3 together. If you get them separately, they may not work as well. They actually don't work as well. There are some general dosing recommendations for glucosamine and chondroitin as well as MSM. Usually they will come together, but we'll put some information about the doses down below for all of these products. Okay, number 2, collagen peptides. So collagen are like main proteins that hold the tendons and ligaments together. So we need a good, healthy source of collagen. So if you take collagen beyond what you normally get in your diet, that gives your body the building materials to create good, strong collagen and repair the soft tissue that may have been damaged. So there's actually a great combination between actually having collagen and rehab exercises. And so we'll talk about that a little bit more in a minute. But are you taking any joint supplements? Are you taking collagen? Are you taking glucosamine and chondroitin? Tell me in the links below. I want to know what works and what you think is helping you. Tell us below. I'll give you a little story. His name is Peter. Peter is 64 years old, and he was recovering from surgery. So he decided to take this 5 stack, right? The stack of supplements. And the next 3 will be described in just a minute. And he noticed better shoulder motion and less pain during therapy. Again, we'll talk about that in a minute, how therapy may be related to one of these. So he tracked his progress each week and saw some real changes, some real improvement in recovery and range of motion and flexibility. So it's always important to track your progress. If you don't have a way to track your progress, we have a post-op shoulder journal that helps you track your progress. So there's a link to that below. Okay, number 3 is vitamin C. Vitamin C, how this works, obviously we know vitamin C from orange juice or whatever. Your vitamin C actually helps activate the collagen. So you have the collagen, you need vitamin C to activate it so it actually can be used and that again creates that strong, usable tissue. Also, vitamin C helps fight off free radicals, not necessarily for this specific, although it can slow down healing. Those free radicals are involved in lots of damaging processes that we have, especially as we age. So in general, vitamin C, we're talking about the recommended dose of about 75 milligrams. However, there's a lot of discrepancy, and there's actually some research to say that if you're having surgery, you're recovering from surgery, maybe you need 1,000 milligrams a day, and that may actually help the actually building of that collagen, building of that healing in your shoulder, in your rotator cuff. If you are finding this helpful, hit the like and the subscribe, please. Helps more people discover smarter ways to recovery. So please check that if you would. Okay, number 4, fish oil, DHA and EPA. DHA and EPA. So they're big long names that I don't know how to pronounce. So I'm just going to say that what they are. Well, they're actually the omega-3 oils, and they actually can help decrease inflammation as well. So they help support healing by calming the immune system, so there's not so much inflammation there. We need so we can keep that joint tissue healthy. For most people, it's about 1,000 to 2,000 milligrams per day for the active ingredient, the EPA and DHA. Also, if you've never taken fish oil, if you've never taken omega-3s, you may notice, depending on the actual flavor, actually, you might notice the fish flavor. So I just would say look for the ones that actually have, say, no flavor, because unfortunately, almost all of them, even the ones with no flavor, may give you a little fish burps. So that's a little bit disgusting. So just look for one that says decreased flavor, decreased fish, all that kind of stuff, because it can be pretty significant if you get a really cheap product like that. Okay, and number 5 is a combination as well. Curcumin, or the thing that works in turmeric, and bioperine, or we call black pepper. So curcumin is the bright yellow part of the turmeric and helps decrease the inflammation and pain. The bioperine, or the black pepper, makes it much easier to absorb. So if you do not have that addition to turmeric, so if you don't have the black pepper to the turmeric, then your turmeric will not be absorbed. So if you go to your spice cabinet, get a big scoop of turmeric and put it in your mouth, you're not going to get that absorption, right? You need that black pepper with it. And so most supplements will, actually, whether it's in a form of a pill or it's in a form of like a tea, usually will have black pepper in it. But that's really important to check that out, because we need to make sure it does. Because again, if it doesn't, then you're not getting the benefits, the health benefits of curcumin. It's a spice, it's a tasty spice, but we also want to make sure it's working for us as healthy. So if you take it daily, it can be a gentle, natural way to help sore joints feel better. And so that's important, right? That's important for recovery from surgeries, or it's important just in general. And if you're looking for a one sort of all-in-one solution, you probably know we have this supplement, the shoulder supplement and it will link it below, that has the glucosamine and the chondroitin, the MSM, the curcumin, and the bioperine. So it has 2 of the 5 supplements all in one. So if you want it, try it out. I use it. It works. So as far as when should you take it, glucosamine, chondroitin, you can take it anytime. May want it with food. Fish oil, again, you probably do want it with food and trying to avoid those burps. The collagen, most people say in the morning, but there's a very interesting data. If you take collagen and vitamin C prior to PT, so collagen and vitamin C together prior to PT, it actually may help increase the collagen synthesis in that area. So it may be important to do that. Now, again, if you're not recovering, you're not going to therapy, vitamin C anytime is fine. But you might want to space them out just to make sure. One of them may be more irritating to your stomach. Others, they generally are not, other than, again, the fish thing. But in general, they're not too bad. They're not very harsh on the stomach for most people. So common mistakes, we want to make sure we don't skip days, right? If you skip days, it may not work. And we need to do this consistently, probably for 8 weeks, maybe 12 weeks. And doubling up, doing more, it is not better, right? Just like in therapy, if you do more, it's not better. So don't double up, take the recommended doses. And as far as the curcumin and the fish oil, it actually they are a slight blood thinner. So you certainly want to check with your doc to make sure it's okay for you to take them. It's very slight, but it's important to confirm. And actually, your doctor, if you are going to have surgery soon, they actually may recommend that you stop the curcumin as well as the fish oil 7 days before surgery. Again, make sure you check that out. And if you need a checklist for getting prepared for pre-surgery, we have a checklist below for that. So if you go below, click on the checklist for pre-op, and we'll send that checklist to you. As we said before, always ask your provider before you do anything, before you take any medicines. It's really important to make sure you are safe, and there's no way to know that without a direct interaction with your physician. So a little quick question and answer. Can I take all 5 together? Yes, you can. Sometimes people would like to spread them out, but you don't have to. You can take them all together. Is this safe long-term? Usually yes. I mean, these are pretty benign, pretty safe compounds, but always talk to your doctor to make sure it's safe for you. Are there vegan options? There are some vegan options. There's some marine collagen, algae-based omega-3s, but it's a little bit harder to get these if you're looking for truly vegan options. So to recap this, right? Glucosamine, chondroitin, MSM for joint support, tissue strength, right? And again, usually they all come together. Make sure that you're getting them all together because that's important. They don't work as well separated. Collagen, again, for stronger stronger tendons and ligaments. 3, vitamin C to help build the collagen, help fight damage, and actually combine with the collagen, maybe better in recovery. 4, fish oil, EPA, DHA, again, things I can't pronounce, but these are important. Make sure it helps calm the inflammation and aids in recovery. And number 5, curcumin, bioperine, or curcumin, and black pepper to help reduce pain in the joints and support healing. So I would again say you need to take them 8 to 12 weeks alongside your rehab, and make sure you're getting your rest. This will create the best opportunity for a successful healing from either surgery or just injury. So thanks. Have a great day, and we'll see you next time.